Coronavirus cases and hospitalizations are falling across the country and here in Michigan. With the weather warming up, there's more data on the effectiveness of COVID vaccines and new treatments as the light at the end of the pandemic tunnel inches closer. Thanks for joining us for the news at 5. I'm Meg McLeod.
And I'm David Custer. Michigan's new COVID data was not posted Monday due to President's Day. But since it was last reported on Friday, the state has seen more than 5,900 new cases of COVID. That's an average of less than 1,200 a day. There were 312 total deaths, and 250 of those were identified during a vital records review.
That brings our state's overall totals to more than 2 million cases and the death toll to 31,695. While the number of daily cases continues to trend in the right direction, TV5's Trevor Sahaki spoke with a doctor from the University of Michigan that says we all need to remain vigilant against COVID.
While the state's COVID numbers are doing well, now is not the time to let up. That's the message from Dr. Suzanne Bradley.
The numbers are dropping slowly. I mean, they appear to be a great change, but remember, we're starting from Mount Everest, about 500 cases on average per day. We're only at 179.
The U of M professor of internal medicine said unvaccinated people are still at risk, even during low transmission periods.
If you have a mild case of COVID, you may not have developed a robust immune response, and a number of people have gone on to get repeated episodes of COVID-19.
If you got COVID and are now trying to get immunized, Bradley said you can get your shots as soon as you feel better. That also goes for kids. Even though they generally get over the virus easily, Dr. Bradley said unvaccinated children are 70 times more likely to die.
So the problem is that we can tell you what your risk is as a population, but for individuals, it's not easy to predict who's going to do poorly.
She said fourth doses are recommended for the very immunocompromised, and the long-term future of the virus is on the horizon.
What we're going to see is seasonal COVID, kind of like seasonal flu, where you're going to have more predictable outbreaks nationwide. And then you're going to have little pockets that may bubble up in local areas.
Bradley said the coming warmer months should provide the same relief like last year. The real test will be next fall. Trevor Sahaki, WNEM, TV5.
A COVID vaccine for children 5 and younger could be approved in the coming weeks. The FDA is expected to discuss Pfizer's vaccine after postponing a February 15th meeting in order to gather more data.